Nerve weakness or palsy refers to anything from weakness to complete paralysis and commonly manifests following any kind of nerve damage. It is transient and fades with time. However, when it is not resolved spontaneously with medication or time, it presents as concerning health issues required to be handled carefully. Nerve problems or neuropathies are considered to be Vata disease in the Indian traditional school of medicine. Vata is regarded as one of the three constitutional groupings known as doshas, is associated with the energy of wind and is primarily responsible for activation of the nervous system. Vata is located in the lumbosacral or Kati region and exerts its influence over cell division, cardiac function, and waste disposal. Vata is revered as prana, the most powerful dosha. In Ayurveda, people associated with Vata dosha are more prone to neurogenic conditions such as neuropathy, rheumatoid arthritis, heart disorders, insomnia, and anxiety. But Ayurveda has cures for all sorts of nerve problems, and in this video, we will try to understand how Ayurveda can help cure all nerve related disorders. So stay with us till the end of this video. Hello and welcome to another video of Ingenious Ayurveda. So let's begin the video with the factors responsible for any sort of nerve damage in the body. So autoimmune diseases including multiple sclerosis, Guillain-Barré syndrome, in which the peripheral nerves are attacked by immune-mediated antibodies, myasthenia gravis, systematic lupus, and inflammatory bowel syndrome. Neoplasm, presence of internal toxins, side effects of drug, motor neuron diseases, diabetes and diabetic neuropathy, nutritional deficiencies, infections such as Lyme disease, herpes infection, HIV, and hepatitis C. Now let's look at the commonly presenting symptoms of nerve disorders. The three forms of nerves in the body are autonomic nerves regulate involuntary or partially voluntary body functions, including temperature regulations, digestion, heart rate, and blood pressure. The second form of nerves are motor nerves, which control movements, transmitting information to muscles from the central nervous system, which comprises of the brain and spinal cord. And the third ones are sensory nerves, which provide sensory data input from skin and muscles to the central nervous system. The data is processed to enable us to feel pain and other sensations. Now let's look at the symptoms which are related to damage to autonomic nerves. So these symptoms are the absence of chest pain in angina or during the incidence of a heart attack, increased or decreased sweating, feeling of lightness of head, dryness of eyes and oral cavity, irregular bowel movement, and abnormal bladder function, as well as erectile dysfunction problem. Now if we look at the motor nerve weakness, so we get to see symptoms like weakness, atrophy of muscles, twitches, and inability to move. Whenever there is a damage to sensory nerves, so we get to see symptoms like excruciating or radiating pain, feeling of prickling, increased sensation to specific stimuli such as heat or cold, and loss of sensation. Now, as we have understood all kind of symptoms that are present in the body whenever there is a nerve related disorder, now let's discuss the Ayurvedic treatment for nerve damage. Ayurvedic medicine for nerve strength primarily comprises of formulations of Vata herbs which improve blood circulation and nerve function. So the first herb on the card is ashwagandha or Indian ginseng. It incorporates ashwagandha or Withania somnifera herb root extract which contains therapeutic components, withanolides and vitaferin A. It is one of the most effective herbs that balance Vata and may be used as health tonic for weakness, enriching physical and psychological endurance through depression of the stress hormone and cortisol. Ashwagandha has antibiotic attributes and also function miraculously in the correction of erectile dysfunction, premature ejaculation, depressed sperm count, and motility. It is instrumental in therapy for chronic fatigue syndrome, weakness, stress, palpitation, restlessness, anxiety, diabetic neuropathy, and sudden weight loss. The next herb on the cards is Brahmi. The protein molecule named bacoside B present in Brahmi fortifies the central nervous system and nourishes the brain to produce a stimulating effect on cognitive ability. It has antioxidant properties which prevent neural oxidative stress and stimulates synthesis of intrinsic chemicals that antagonize neural damage. It also equalizes dopamine levels and shields the cerebral components actively involved in serotonin uptake through the actions of bacoside A, thus balancing neurotransmission. The next and the last herb on the cards is Shankpushpi. It curbs neurotoxicity and relieves stress. Alkaloids present in Shankpushpi elevate serotonin synthesis and perform the role of a brain tonic in Ayurveda, enhancing memory and promoting intelligence. It is also used for checking a wide variety of neurodegenerative disorder, cerebral hypertension, over anxiety, stress, seizures, and insomnia. But do not stick to these remedies only if the problem is chronic. You can seek help of an Ayurvedic expert and go for real Ayurvedic treatment to get rid of any kind of nerve related disorders. So, friends, this is it for this video. We hope you find it helpful and interesting. To watch more such videos, don't forget to subscribe to the channel and hit the bell icon to get all the latest updates of our upcoming videos. Till then, stay healthy and stay fit and stay connected with Ingenious Ayurveda.